So currently in orthodontic residency education, orthognathic or jaw surgery treatment is taught in a very two-dimensional way. Basically, we use a two-dimensional film, a radiograph, and then we trace our outlines of the profile. We cut them into sections of the jaws, upper jaw, lower jaw, maybe the chin, and then move them around on a tabletop to predict possible movements in a two-dimensional way. Unfortunately, what's lacking is the three-dimensional view, the views that you can see in the horizontal as well as vertical and in the transverse dimension. So in order to improve upon that, I think just visualizing the entire skeleton, not just the profile view, is a very important part of looking at patients. So the first time I came to the 3D lab, I was introduced to MyDen, which is a virtual reality room or space. And I decided, well, having a skull in front of you and moving around this object and manipulating the skull might be a very important way for students to learn. The collaboration occurred between oral surgeons who provide the orthognathic treatment for their patients. And the patients were kind enough to give us their permission to utilize their images, 3D images, from cone beam tomography data, CBCT data, that we can utilize to model a clinical situation such as a jaw deficiency.
It's an interesting path that they take. They start off as something like an MRI scan, and then another one of our staff who has more specialization in that sort of software can extract, using density filtering, mesh from those MRI scans, and then we pass it to Stephanie O'Malley, our artist, and she cleans up the meshes and creates a hierarchy of bones for animation, and she passes it to me as an FBX file.
Unfortunately, though, because I am at the School of Dentistry, which is a little bit away, a portable option was an important part. Luckily, at the 3D lab, they were also working on a portable type of a VR equipment called the Oculus Rift.
The Oculus Rift is a virtual reality device. So for this device, you put it on and it completely immerses you in your virtual environment.
The Oculus is ideal because it can be mobile. Several stations could be set up within any number of facilities at the university as a whole, including School of Dentistry. So I think that including advanced technology such as virtual reality has a good place in learning and teaching students and residents in clinical situations, and I hope that we can see more of that in the future in research as well as practice.